That I do mumble once in a while. I don't know why. I can hear myself perfectly. But here we go. So yeah. So presentations. When Deanna first emailed me to say this meeting is on, I was sure that I had put it in my calendar, but it was quite some time ago, and it's not in my calendar. It wasn't in my calendar. In any event, at that particular point in time, I wouldn't have come. I would have had to, similar to how many of us have had to take prolonged breaks from our activities. I was in the middle of a November to a couple of weeks ago break, and yeah. So when she reminded me, called to say, "Hey, listen, are you coming? And could you make a little talk?" I was just nicely getting what I consider back to normal, and I said, sure. But as it turns out, when I sat down, I used to do presentations like this for a living. You know, people used to pay me to talk to them about their problems, and I really think I would have to pay them at this point in time, because I went and sat down a couple of times to throw something together. I thought maybe it'd be a PowerPoint or something like that. You know, what is the CPPN and what have we been doing? And nothing, absolutely nothing. Complete blank slates. Sit in Starbucks for an hour and a half, nothing. And that, along with many other, well, most other things, were depressing for those particular 2 days, and as Agnes knows. And so I thought, well, I've gone from way up here to down, or from down here to up here to down here, and now I'm wondering, well, maybe I'm just bipolar or something. I don't know what's going on, but but on the ride down here this morning, sitting in the car, you know, in 40 minutes, I'd sketched something out. And so I thought, well, I'm just going to talk. Do you have PowerPoint? No. So the first thing I'd like to say is that I don't believe that I would be here, certainly not in any useful form, maybe even not physically on Earth, if it wasn't for help from Agnes. It just wouldn't have happened, for many, many reasons, which I will not go into. And the first thing I want to ask for the people here, the patients here, has anybody else experienced that or had something similar to that? Where their spouse has made such a huge difference in their lives. I mean, things just wouldn't work out otherwise. And I think we can all speak to that. Equally, and somewhat more appalling, is I have become more and more aware of people who relationships have fallen apart because of this disease or this illness. And is anybody familiar with anyone who's been in that kind of a situation? Now, you need to kind of throw your hand up, but you know, just so I can. So it happens more than I would have ever guessed, but you know, it's not surprising, because it is tough. It is tough on family. And has any of the patients here experienced real problems with their mental health? And first of all, patients. I can't remember who's a patient. Put your hand up if you're a patient. Okay. Now leave it up if you've had a mental health issue. Yeah, about 70% or so. Problems maintaining your position at work, maintaining your job. Or losing your job. Losing your job, having to go on LTD or something like that. Okay, it's predominant. Experiencing other related illnesses, headaches, adrenal issues, you know, so when you look at these Facebook sites, you know, the Pituitary foundations, whether it's an American or UK, Australian, Canadian, it doesn't matter. But you just see, if you sat down and statistically went through what it is that is bothering people, headaches, for example, are there all the time. People talking about headaches and talking about their doctors say, well, we'll just monitor it. Your headache is not related to the pituitary tumor. Pituitary tumors do not cause headaches. It's not causing any pressure on anything else. So you don't have a headache that's caused by pituitary tumor. And the patients are going, essentially, F you. I believe it is. And everything else that they can all go find evidence of it. The point is, with all of that, is that the symptoms of pituitary disorders impacts so many things and so many people. And far beyond being a benign tumor that should be monitored, there's much more that needs to be done in the area of research and in education of everyone from the government decision makers to medical professionals to the nurses that we might experience be lucky or unlucky to experience as we go through some sort of crisis or another. They need to know about pituitary issues more specifically, and in our particular case here, acromegaly, is one of those many pituitary issues that share so many things in common. And so that's really where the CPPN focuses. It's focused on all of the pituitary issues. And I was just going to read off of you because I don't even know what these are. I can't even pronounce some of these. But here's a list of 30-some pituitary issues or diseases, if you will, that affect people that have an awful lot in common with what acromegaly is. So just take something like depression or mental health. Okay, so we've got adrenal cortical neoplasts, Rask cleft cysts, pituitary germinoma, Cushing's, craniopharyngioma. What are you laughing at? Wolfram syndrome. These are things that I don't know, but they might be 1 in a million as opposed to the statistical numbers that we deal with in terms of the number of acromegaly patients. But the point is, in all of these cases, if the tumors were identified earlier, okay, and dealt with to the best medical practices that exist at the time, all of these patients would be less of a burden on themselves and their families, the financial system of our country. Everything else would be better, healthier, happier, the whole bit. Diagnosed early, in the case of acromegaly, maybe when you're in your early 30s, and the tumor is removed, or the drugs are given to reduce the impact of the excess hormones, and you can come out of it just like a normal human being. Wait too long, and you end up like a lot of us in this room. Okay, you're on LTD, and you're on, my drug bill every month is somewhere north of $10,000. Okay, because nothing else worked, and still at 10 grand, it doesn't really work 100%. So there's much to be said for improving the way that we can improve on the way we deal with these patients, us. So the mission statement of the Canadian Pituitary Patient Network, which, as Deanna mentioned, she was one of the persons who kind of pushed it forward, and Cord helped organize it for us, blah, blah, blah. I won't go into all that kind of stuff, but it's like 2 years. And the mission of the CPPN is to support pituitary patients, caregivers, and healthcare providers in Canada to do what is necessary to ensure pituitary patients live fulfilling lives by, number one, supporting the development and ongoing work of regional patient groups. Regional groups offer the most effective means of effectively meeting the social needs of pituitary patients through meetings such as this and conventions, et cetera, and monitoring Facebook sites. It's a way for patients to connect with each other and know they're not alone. learn new things. Number two, by supporting regional, national, and international initiatives for the required changes. And so there's much that falls under that heading, and I'm not going to go into the details here. Number three, by lobbying government, the regulators, the payers, the educational institutions, and the pharmaceutical industry for required changes. And number four, to support the development of and access to early detection, diagnosis, clinical trials, and effective treatments at the regional, national, and international levels. So those are the big picture things that the CPPN feels are important at this point in time. And I suppose they could be adapted, amended, or changed or added to in the future as we go forward. So having said that, there are a number of priority activity areas that we're attempting to deal with when we're healthy. And in the area of social media, awareness, education, what does that say, Brent? Oh, advocacy and lobbying. Okay, all of those things, there's an element of them that fall under the heading of social media. So we'd like to get a lot better at that, more coordinated, be able to direct patients and caregivers to the right places at the right time. Oh, sorry. The second one is the awareness days. So there is a National Acromegaly Awareness Days, which is sponsored by, help me out. No, come on, I don't get it. My brain goes dead.
Katia Endeman, the company?
Yeah, no, the company.
Endeman and Pfizer's.
Yes, okay, thank you, by Pfizer. So all we really do with respect to that is act as a recipient funnel for the money, basically. So all we're doing there, as well as helping out where we can. The third one that we'd like to move forward to is issues of drug access, okay, or drug navigation to require the drugs that are required, particularly when there's no payers or there's problems with payers and accessing the drugs, or access of drugs which may not currently be on the market in a particular region or a particular country that are available elsewhere. An initiative dealing with patient-controlled health information. And by that, if you can imagine the situation where if you get yourself to the hospital because you're in some sort of an emergency situation, and of course no one knows you, they know nothing about your case, they can try to look up the information that they have, perhaps on their limited data access on their hospital computer, but you happen to be from another province, so they can't access any of that. And so you tell them everything that they need to know, and they go, "You're a patient, so just be quiet. We'll take your blood here, and then we'll let you know what's wrong with you again." They won't trust perhaps a family member that is with you, or you bring in some sort of documentation and they don't have time to read it, and even if they did, do they trust it? Do they make their decisions based on the anecdotal evidence that has been provided to them? And the answer is they're unlikely to feel that that is the best way to proceed. And so they start from zero, or they start from a place which is not useful to you. And so there's many conditions. I think some of the adrenal crises are in particularly where you could end up freaking near dead, before they would be able to figure out what's wrong with you. Whereas if you're able to bring some form of electronic health record with you, or have it accessed, where all of that is there, all your information is one place, and you are the authority, it's your information. You can look at this. I need you to look at this. This is what it says. This is what I have. This is what you need to do. It's all there. It doesn't take an hour. It's there now. So that is patient-controlled health information, one aspect of it. Recruitment of financial stakeholders, and then putting together a medical advisory committee to advise on some of these issues and how they should go forward, and maybe what we should be focusing on, needing to focus on, and those types of things. So those are some examples of the types of issues that we feel may be most important at the national level that we can work on. And of course, then there's always the problem of pursuing resources, which seems to be the only thing that ever gets dealt with because you never have any. All right, so you can't move on to the big picture stuff because you haven't got anything of the other stuff. So, of course, what are the resources? Money. Okay. Social media money. You got to chase that down. Technology. Well, if you've got social media money, now do you have the technology to deal with it properly? Can you deal with privacy concerns, with members' names and blah, 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 a whole host of things, which I don't even want to know about, but I just know that they're problems. And then there's, of course, the human resources, which anybody who has tried to run any kind of volunteer organization is intimately aware of, that once a person such as in Atlantic Canada, Peggy is the driving force behind Atlantic Canada, acromegaly, and I think they're also dealing with Cushing's. In BC, Deanna and Peter, and so we have actually 3 people, and I think Deanna is the ultimate driving force there. Well, same issue. And CPPN. What happens if those persons are out of commission for 6 months, 12 months, forever? Who's going to take their place? What happens to the organization and all the big plans? And so human resources are an ongoing battle. You can't pay anybody. And it really is a challenge to find the right people who are able to step up to the plate and actually drive things forward in a strategic way. Particularly because there are so many needs. I mean, there are so many voluntary organizations. I mean, if you're a funding source, we can all imagine how many organizations are applying to them for these needs over and over and over. It's a big issue. So pursuit of resources, I think, is the major thing that holds a lot of these initiatives back, because so much time and effort has to be spent on pursuing them that other things just don't get the attention they deserve. So that's it, unless there are some questions, and then I'll wrap it up. No questions? All right. That's good.
I was going to mention, there is a website for CPPN that anybody is able to go and look at and read up on what they're doing and who they are. And there's now 3 small support groups underneath the CPPN. So we are a member of the Bank of Rockland Support. We are a member under the CPPN. And yeah, that's a way to go and read up on what they're doing, or get involved if you want to get involved in helping on the board, or stuff like that.
Well, please do, obviously, and hopefully we can kind of get things back up and running and up to date, because I think it's slipped.
Could I have a website?
www.
Yeah.
Dot